A little later, we looked at the effect of venous stenting on intracranial pressure, and we studied this in 50 patients who had spinal tap with us before stenting and at 3 months after stenting. And we have shown that the average opening pressure on a spinal tap decreased from 37 before treatment to 20 after treatment. And this was, again, the post-treatment spinal tap was at 3 months after stenting. At the same time, we looked whether...
Can I interrupt here, Athos? What is the normal CSF opening pressure?
Well, that's, I mean, I would say, below 20, we consider it normal in general for the average adult. Above 25 is abnormal. And between 20 and 25 is that gray area that has to do with body habitus and some subjectiveness. So 20 is the upper limit of normal in reality. We saw whether medication usage was the factor here, but actually we saw that at the time of the post-stent spinal tap, there was 70% less Diamox being used by the patients. The majority of patients were actually off Diamox completely, and the rest were taking less, but on average, there was 70% less Diamox usage. And in terms of weight gain, we saw that there was no significant weight loss to explain or to confound these results. In fact, most patients either had an unchanged weight or a very small weight gain. And unchanged weight, I believe we defined it as within 3 or 4 pounds from the pre-treatment weight. So the weight was not a factor. Medication usage was certainly not a factor, and the only difference in this situation was the stenting procedure.